The mood check's really an underutilized part of CBT. The importance of it is you want to get a sense of the client's mood week to week just to make sure they're improving and what you're doing is making a difference. So when there's an improvement week to week and the client says, oh, my mood's improved somewhat, I want to get a direct measure of that either through a measure like a Beck Depression Inventory or just a scale 1 to 10. And when the mood's better, I'll ask a question like, okay, what did you do to help improve your mood? So I'm going to want to use this as an opportunity to give them credit for making a positive change so they have that self-efficacy, like what they do can make a difference. And when they say, oh, what I did this week was I evaluated thoughts that led to my mood just feeling really anxious. And I would say, okay, great. And then this is a perfect opportunity to use the mood check to set homework or an action plan for next week. So I would ask, is that something you want to continue for next week? Also, it's important to get positive moments during the week for the mood check because a lot of our clients who are anxious or depressed focus more specifically on the negatives. And then that gives them a sense that their entire life is bad or depressing or anxiety provoking. So you want to give them evidence to the contrary that makes them feel like my entire life's not bad. For the times when the mood hasn't improved, that's a great opportunity to get at agenda items. So if someone says, my mood was a lot worse this week, I would ask, what do you think contributed to that? And they might say something like, well, I got into a fight with my boyfriend. So that's a perfect agenda item there. And I would say, okay, is that something you want to put on the agenda? And if their moods consistently hasn't improved over the weeks of me seeing them, I'm going to want to think to myself, okay, what's getting in the way here of improvement? And am I going to have to look at their cognitive conceptualization and treatment plan and make some adjustments here?